Hi, I'm Dr. Ed Beyer. We're continuing our discussion here on leaky gut syndrome, which is a condition where the barrier, the main barrier between the outside world and the inside of our body, that one cell layer lining of our gut, starts to break down. We form antibodies to proteins that break down. That can lead to leaky blood-brain barrier and so on. Reason number 2, medications. There are many medications out there that many people take with chronic illness that is actually causing them worse intestinal permeability or leaky gut. Let's get into it. Corticosteroids, hydrocortisone or Cortef, cortisone, prednisone, Medrol, Symbicort, Flovent. A lot of these taken for bronchospasms seen in asthma, and Advair. These medications break down the gut barrier. I am not making this stuff up. This is all in the scientific literature. Just Google it. Now, the irony is that these medications actually are given to people to knock down inflammation, or they're given for autoimmune disease, and it does do that. It decreases inflammation short term, but what it does in the long term, it breaks your gut barrier down, which, if you've been watching my videos, causes more inflammation. So it's one of those type of medications that it's okay in the short term, but to chronically be using them breaks the gut barrier down, it actually causes more inflammation in the long run. That's the irony behind these medications. Leaky gut syndrome is the gateway to all autoimmune diseases. It is the #1 trigger to autoimmune disease and to any inflammation. It can be tested for and it can be fixed. Very important that my patients understand that. Now, some other medications that will cause leaky gut syndrome or increased intestinal permeability: antibiotics. When someone takes an antibiotic, it's going to destroy the bad bacteria, and it's also going to destroy the good gut flora, which you're going to learn later can also cause leaky gut. Proton pump inhibitors like Nexium and Prilosec, omeprazole, and things like that cause a decrease in the acidity of the stomach, and that changes the pH of the gut in a bad way, and then that'll break down the gut barrier. Non-steroidal anti-inflammatory drugs like Advil, ibuprofen will break it down. And that's another irony. We take Advil or ibuprofen to knock down inflammation, which it does in the short term, but in the long term it's setting up a scenario where you actually have more inflammation. So chronic use of these is not a good approach toward inflammation. And certain chemotherapies will also cause this. I'm Dr. Ed Beyer. I hope that helps. Have a great day.